Hi, I'm Dr. Moodley, and welcome to this live webinar presentation from Edelweiss Dentistry. The last time we spoke, I spoke about the Edelweiss virostatic shield and how to prevent transmission of bacteria from person to person through the use of the Edelweiss virostatic shield. Today, I'm going to speak to you about how to protect yourself through the use of hand and surface disinfection. Because we know there's millions and millions of viruses as well as bacteria on your hands, and not only on your hands, but also on the surfaces that we may touch. Through the use of hand and surface disinfection, we can break this cycle of transmission from surfaces to your hands and prevent you from being infected. So CDC recommends that we should be disinfecting, especially now because of the viral pandemic. We should be disinfecting our hands on a regular basis whenever we come from the outside indoors, before meals, as well as before preparing meals. If you touch a surface that you think may be contaminated, you should be disinfecting your hands, as well as before bedtime, you should be disinfecting your hands. And not only should you be disinfecting your hands, but you should be also disinfecting surfaces that you think may be contaminated. For example, the handle doors, lifts, as well as if someone else used your phone and possibility of transmission of viruses or bacteria on your phone, then you could disinfect that as well. Right, why does surfaces need to be disinfected? We know, and there are several studies being done. This is from the New England Journal of Medicine, has shown that viruses may remain on surface for a long period. For example, on cardboard boxes, it may stay there for a day. So you need to have some sort of protection preventing the transmission of bacteria or viruses from those cardboard boxes onto your hand, preventing you from getting infected. But the problem now is, how do we choose a disinfectant? We know there are thousands and thousands of disinfectants available on the market. If we go to the store, you'll see shelves from the bottom to the top filled with disinfectants. How do we make a choice as to what is the correct disinfectant to use? Number one, how do we know, how is guaranteed that if we use a disinfectant, do we know that they are killing all the viruses or bacteria in our hands? We know there are a lot of disinfectants that are homemade. They have homemade recipes available. Some are made by distilleries. How do we know they are effective? Okay. Choosing a disinfectant can be sometimes confusing because there are so many on the market. They have different chemistries. For example, they could be alcohol or non-alcohol disinfectants. They work differently. Number three is, what about the contact time? Does it take 30 seconds to kill viruses or bacteria? Or some of them can kill between 5 minutes or 10 minutes. So how do we know how effective it is over a period of time? And number three is, some of them require mixing. Some of them can be directly sprayed onto your hands. So these are some of the confusing things that we need to look at with regards to choosing a disinfectant. When we consider choosing a disinfectant, we need to look at the effectiveness. Does it kill all the viruses and bacteria or the pathogens on your hand or on the surface? Number one. Number two is, what about the kill time? Does it last 30 seconds to kill it, or does it kill it over a long period of time? When we're spraying on the surface, does it still remain wet on the surface to allow all the pathogens to be killed, or does it evaporate quickly, thereby not killing any viruses or bacteria on the surface? So we need to consider the kill time as well. Then we need to look at the safety, how safe it is for us or our children to use. Are there any contaminants present in the disinfectant? And number four, how easy it is to use. Do we simply just spray it or wipe it? Or do we mix two solutions together to get the disinfectant? So again, these are some of the things that we need to consider when choosing a disinfectant. So the number of steps required to use a disinfectant. I need to clarify two terms, a sanitizer versus a disinfectant. And there seems to be some confusion with regards to these two terms, but often they are used loosely. and can be confusing. A sanitizer simply means removing pathogens, either viruses or bacteria from the surface. They may or may not kill during this process. Whereas a disinfectant is meant to kill at least 99.9% of the viruses or bacteria or pathogens. So this lecture will be mainly dealing with disinfectants, and that's what I'll be talking about. On the market nowadays, we generally have two types of disinfectants, namely alcohol-based versus non-alcohol-based. With regards to alcohol-based, the most commonly used is ethanol, which should be minimum 60%. Between 60 to 90% of ethanol is effective and would kill virus and bacteria. Anything less than 60% is not effective or non-potent. With regards to isopropyl, should be 70% and above. Unfortunately, according to Stephen Hahn from the FDA, unfortunately, because of this virus pandemic, there's been a huge demand worldwide for the usage of sanitizers or disinfectants. And because of this, the supply has been short. And many companies have been trying to produce sanitizers, disinfectants, putting people's lives at risk by selling inferior products, and some of those products may contain unacceptable or dangerous ingredients. So one needs to be very careful when choosing the right disinfectant. So, for example, the EU, the RAPEX, that is a Rapid Alert System for Dangerous Products, have recalled many of the products because they are either inferior or they may be a risk to the patients. Several hundreds of sanitizers and or disinfectants have been recalled by the FDA, again, because they are subpotent or they may contain dangerous contaminants in the disinfectant itself. And the consumer is not aware of this. So in the EU itself, as reported illegal or ineffective disinfectants in June 2020, 20 of the member states have reported an increase in non-compliant disinfectants. Why is it non-compliant? Many of them do not have the proper authorization or permit to label it as a disinfectant, number one, or they may lack hazard labeling. It may contain subpotent concentrations that are not effective against viruses, maybe due to either insufficient concentrations or contaminants in the product itself. So you may be buying a disinfectant or sanitizer that may not work for the coronavirus. How do we know that we are buying something that's going to work? Because of this the safety issue, there's also been some contamination within the disinfectants itself. For example, the FDA has reported some disinfectants causing blindness and hospitalizations. And there's also been deaths reported as a result of ingestion of contaminated hand sanitizers. Again, Stephen Hahn from the FDA has reported that toxic methanol present in some of the sanitizers is dangerous and may cause headaches, dizziness, amnesia are some of the dangerous side effects of methanol. And no one should be using a disinfectant that contains methanol in the hand sanitizers. Several have been recalled. For example, this isopropyl has been recalled because of subpotency. This has shown to contain methanol, and this has shown to have 1-propanol as well as containing methanol in it. So they have been retracted. But what about those that have not been retracted? So some of these disinfectants or sanitizers on the market, on the shelves in supermarkets, may contain a chemical risk. Anything that contains methanol should not be used. No consumer or health worker should be using a sanitizer or disinfectant that contains methanol in it. Then, of course, there's a health risk. How do you know that the concentration is sufficient to kill the pathogens on your hands? So they may produce may have a health risk with regards to you still having the pathogens in your hand after using those disinfectants because you think that you're killing it, but in fact, you're not killing it. Of course, many has been recalled as well because of they do not have the, if they are alcohol-based, do not have the hazard pictogram regarding flammable disinfectants. So because of this, Edelweiss has come up with an innovative disinfectant which kills 99.9% viruses and bacteria and is 100% alcohol free. So why did Edelweiss make a disinfectant that's 100% alcohol free? Because this is what happens with continuous use of alcohol-based disinfectants. It causes irritation to the skin. It removes the oily layer on your skin, causing your skin to become very sensitive, very itchy. And also for children, may have this alcoholic smell as well as can be irritating to the skin. Again, showing the use of continuous use of alcohol causing some irritation to the hands or your skin. So because of this, Edelweiss decided to go for a non-alcoholic based disinfectant. But they had to do a test on that to see whether it is dermatologically safe. An independent lab here in Austria, the WHO lab, has dermatologically tested this and shown to be perfectly safe for both children as well as adults. Even children with sensitive skins have been shown to be okay with this Edelweiss disinfectant. But not only was the safety important, we needed to look at how long it lasted on your hands. Because it is alcohol-free, it does not evaporate that easily and therefore would be long-lasting on your hands, giving you 100% protection with regards to killing pathogens. So what is this Edelweiss disinfectant? It is, the main ingredient is a chlorine dioxide, which is a highly reactive oxidizing solution. Okay, it contains no impurities or contaminants, made of only 3 ingredients. It is totally non-toxic as a chlorine dioxide breaks down into chlorides, which then disintegrates. So no contaminants or impurities present in the Edelweiss disinfectant. So not only did we look at the safety of the disinfectant, we wanted to see how effective is this. Does it really kill all the pathogens? WHO lab in Austria, an independent lab, has done studies for us, and they found that not only does it kill the bacteria and viruses, but it kills candida and spores as well. What about the time? What about how does it kill it? So once Edelweiss is sprayed on the hand that contains a pathogen, the Edelweiss disinfectant breaks the bacterial wall, thereby causing the contents of the bacteria to come out, killing the bacteria. With regards to viruses, it interferes with or breaks down the RNA, thereby killing the viruses. So over time, we wanted to see how effective it is over time. What is the time period for it to kill these pathogens? So we looked at a time graph where we looked at the organism survival, started with 100%, and on your x-axis, we looked at the contact time. We found that on a 1% solution, within 30 seconds, it killed all viruses and bacteria. So the Edelweiss disinfectant is effective within 30 seconds, killing all viruses and bacteria. So how do you use it? If you spray a generous amount on the palms of your hands and rub it for 20 seconds and let it air dry for 10 seconds, giving you a total working time of 30 seconds. And within this 30 seconds, you will kill all pathogens on your hand, that is, including viruses and bacteria. So this ensures maximum efficacy of the Edelweiss disinfectant, giving you a total working time of 30 seconds. So not only is it effective on your hands, but also on your surfaces. Because it does not evaporate that easily, when you spray it on a surface, you would see the liquid remaining on that surface for a long period, thereby being effective, killing viruses and bacteria over an extended period of time. It can be safely used on your phone, does not cause any damage because it does not contain any contaminants, neither does it contain any alcohol in it. Right, so overall, what are the main features or advantages with regards to the edelweiss disinfectant? We said it is 100% alcohol-free and does not contain any impurities or contaminants. It's mainly made of 3 ingredients. And because it's alcohol-free, it is non-irritating to the skin and can be safely used by children as well as people with sensitive hands. Because it's non-alcohol, it's alcohol-free, it's long-lasting on your hands. It does not evaporate that easily and stays over an extended period of time. It kills 99% of the viruses and bacteria. And we know through independent tests that within 30 seconds, it will kill 99.9% of viruses and bacteria, guaranteeing total destruction or killing of the pathogens on your hands, as well as surfaces. Because it does not evaporate, it's ideal to use on surfaces over an extended period of time. It is pleasant smelling. It has a smell of Swiss pine, making it also child-friendly because it's non-irritating to the hands, does not have that strong alcoholic smell, and has a pleasant Swiss pine smell. Then it has been dermatologically tested and safe to use for people with sensitive skins as well as not causing any eczema or irritation to the skin. It is non-toxic. The chlorine dioxide breaks down into chlorides, which then eventually disintegrates or degrades, not leaving any remnants. It can be safely disposed of. The plastic container itself can be disposed of as you would dispose of any other plastic containers. Finally, because it's a non-alcoholic disinfectant, it's much cheaper to produce and therefore cost-effective to the consumer. So once again, I'd like to thank you for listening to this webinar. Should you have any queries or any questions, please contact me at the Edelweiss offices. This is my email below, and I will be glad to answer any queries or questions that you may have regarding the Edelweiss disinfectant. Once again, thank you for listening.